So do you feel it here or more across the body?
Across the body. Yeah.
Perfect.
I'm gonna go here on the right side too. And again, you can see this nice thick muscle here of the low back, clear of any fluid masses. Go ahead and take a deep breath for me. Good, and blow out. You're gonna feel a little bit of pressure. The fluid's going in. This is lidocaine going in to the muscle, and that is it. I only go about a ½ inch in. It's not really deep where I have to get into the muscle. I kind of use my thumb here, kind of work it in.
Hi guys, welcome to Oak Brook Medical Group. If you guys are new here, we are an integrated chiropractic clinic, meaning we have chiropractic, physical therapy, massage therapy, and then medical services as well. We help patients that have pain from their neck down to their low back, their hips, knees, shoulders, basically whatever it may be. So this is a little glimpse into our clinic. Like I mentioned earlier, we have a bunch of different services. So all of these videos are gonna show how those services can help you decrease any type of pain that you've been experiencing. All right guys, this is Dr. Mike. He is our chiropractor. So within this video series, we're gonna talk about low back pain. So he's gonna go a little bit more in detail about that.
Yeah, so we've been having a lot of patients come through lately, having things like low back pain, disc issues, disc degeneration, sciatica with that pain traveling down the leg, and even pain into like the glutes and the hips there. So make sure you pay attention to these videos to see what we can do best for you to help you get out of pain.
All right guys, in this video, we're gonna show you how we do stretch out our patients that come in with any type of low back pain. So we do a Pnf Stretch, which is a contract relax movement. So this is gonna help us get a deeper stretch rather than if we were just doing something like a static stretch. So we're gonna show on Katie here 2 different movements per side. So go ahead and lay flat on your back. The first stretch is gonna be more of the hamstring, so the back of the leg. So we want a nice straight leg. If the patient does have low back pain, you wanna make sure this leg is bent so we can take pressure off of the low back. What we're gonna do is bring it up as high as we can until they feel the stretch. So let me know when.
Okay.
We're gonna hold this movement here for about 6 seconds. And then when I say when, she's gonna press her leg back into the palm of my hand. So go ahead and press back for 3, 2, 1, and then relax. So the point of this is when she presses back, I don't just want to let her leg fall down and relax. We're holding it in this spot so that when she relaxes, we are able to go a little bit further the second time. You're gonna repeat that 3 times total. The next movement we're gonna do, go ahead and bend at the knee and then straighten this leg. This stretch is gonna be more glute piriformis, so on the outside of your leg. There's a few different ways you can stretch your glute piriformis. So I always ask the patient, like, if you feel it here more or if you feel it here, just whatever their preference is. So do you feel it here or more across the body?
Across the body. Yeah.
Perfect. So same thing, we're gonna hold this here for about 6 seconds, and then she's gonna go ahead press her whole leg back towards me for 3, 2, 1, and then relax. Then we go a little bit further. Same thing, we're gonna wanna do that 3 times each side total, and on both sides. So this is a great way to help stretch out your legs, which is also gonna help stretch out the low back, also increasing your range of motion. All right guys, welcome back to another video. I have Liz.
Hi y'all.
And Katie.
Hi.
Within this video, we're gonna explain the medical side of things that we do here. So we have non-steroid based injections, like trigger point injections and then joint injections. Within this video specifically, we're gonna go ahead and talk about the trigger point injections into the low back or the glutes. So a lot of patients that come in, they'll have knots, trigger points, adhesions, like within the muscles, and that's gonna be built up scar tissue. So we have a lot of different ways that we can help break that scar tissue up. But Liz is gonna explain the trigger point injections, and then we're gonna show them on Katie.
Yes, so the trigger point injections in the low back and glute area, the whole goal for those is to decrease, like Danielle said, the muscle tightness and those adhesions. Once we get the muscles in the glutes to relax, it's going to take pressure off of the lower back, and that in turn will help with pain. The whole goal is to increase mobility, increase range of motion and function within the low back and glute area, which in turn, in the rehab portion of exercising, they will be able to strengthen those areas, those muscles, to make things stronger. Hi, I'm back. This is Liz, and we're going to now demonstrate the trigger point injections into Katie here into her lower back muscle. Typically, the most common muscle in the lower back that I do inject is called the quadratus lumborum muscle. It runs on either side of the spine. So when I'm doing the low back trigger point injections, I do want to keep things balanced, and I want to do the right and the left side. So first thing that I'm going to do is I'm going to use my thumbs here, and I'm going to find that tight knot or muscle here in the lower back. Next, I'm going to mark it just like so, and you can see the little circle here, and that's how I know where I'm going to go with these injections. Next thing I'm going to do is clean it with an alcohol wipe. Next, I'm going to ultrasound the muscles here, because I got to make sure that the muscles in the lower back are clear of any fluid in them or any masses that will show up here on the ultrasound machine. All right, so right now on the ultrasound machine, here's the muscle coming through the center of the screen here, and I don't see really any fluid in the muscle, and there's no cysts or lumps or adhesions in the muscle. This is what a typical nice low back muscle looks like. I'm gonna go here on the right side too, and again, you can see this nice thick muscle here of the low back, clear of any fluid masses. Next thing that I'm going to do is I'm going to clean off the gel. All right, and now I'm ready to do the injection. Katie, are you ready?
Yep.
Okay. Go ahead and take a deep breath for me. Good, and blow out. You're going to feel a little bit of pressure. Fluid's going in. This is lidocaine going in to the muscle, and that is it. I only go about a ½ inch in. It's not really deep where I have to get into the muscle. I kind of use my thumb here, kind of work it in.